Doctor, good morning to you. Thank you for your time in speaking to us. The issue with COVID-19 from a hospital perspective, very good in handling COVID-19, but Marcel and I were talking off air. Government always refer to these, I think you used the term unintended consequences, and people not being able to get screened for various cancers, but particularly breast cancer during lockdown, has caused a major issue, I'm sure.
Yes, thank you so much for having me this morning. Good morning, and good morning to the viewers. What we actually saw, and I think this is not even a South African issue, this is a global issue. We know that during COVID, most of the non-COVID healthcare services were deprioritized, and therefore, like you rightfully say, that did not happen. And I think in the breast cancer space, it was not just about screenings, it was also about diagnosis. You will understand that during COVID, because the hospitals were almost reserved for, COVID admissions, surgical admissions were therefore, and surgical interventions were deprioritized. So with breast cancer, you know that you do need sometimes to do some surgical interventions to get to a diagnosis. So what we've seen is that, yes, the screenings went down. Our Discovery Health Medical Scheme data shows about a 51% reduction in mammograms that were done during the time of lockdown, and, over 40% reduction in the number of diagnoses that were done during this time. So unfortunately, the pandemic did have a significant impact in both the screenings and also just for those people who already have maybe a lump that has been identified, just the diagnosis. And it's quite concerning because in the long term, we may end up with people who are diagnosed later on in the disease, and therefore it becomes much more complex to treat, and the survival benefits are therefore minimized by this.
Let's talk about that a little bit. I mean, whenever you have a conversation about cancers like breast cancer and cervical cancer as well, early detection is the phrase that you hear repeatedly from clinicians who work in that space. What could the repercussions be? I mean, we know that people put off going to doctors, going to hospitals, as you just said, screenings, mammograms, their checkups, which are important for those still on their cancer journey and even those who are post their treatment. The repercussions on our hospital system or on our medical system could be quite vast as we now enter further into lockdown level 1.
That's all right. And I think if I look at the impact is at a patient level where we're saying, if your cancer is diagnosed early, your chances of survival, so we talk about 5-year survival rates, we know that early diagnosis and early detection of cancer results in in some cancers, breast cancer, colorectal cancer, even cervical cancer, because we also, when we did our data, we looked at cancers where there already are some screening programs that already exist. There are certain cancers that you may not necessarily be able to screen for, but when you do get specific symptoms, we would want you to go and be checked by a doctor so that the diagnosis can be made early. So we talk about survival rates that are beyond 90%, meaning that at 5 years, those people, even though they are, diagnosed with cancer, they can still live for a very long time. Well, and you find that the interventions that are also deployed at the time are less invasive, they are much easier to treat. On the other end, if we get advanced cancers that would have spread to the body, we talk about metastatic disease, we know that firstly the survival benefit or survival rates, they drop significantly if the cancer has spread beyond where, the original site. And we also know that it's much more expensive and much more difficult to treat those cancers. So it does, place a significant burden into the healthcare system if we do not, detect these cancers early.
Doctor, if I can bring in, I'm sure you're aware of the name, Head of Cancer Alliance, Linda Greef, also in an article referring to this exact topic that we're busy talking about at the moment, saying that she's noting shortages of cancer drugs due to COVID-19 and the restrictions of bringing those medications in from whatever country they need to come from, saying that there's a severe and short supply during this pandemic. Can you give us a sense of where we are on this? Now we're well into level 1. Are we back where we should have been all those months ago?
Yeah, I think maybe, we must always differentiate. In the private sector, we were not alerted to any drug shortages. And I think we did try to ensure that even at the beginning, the way drug, access is managed is such that members who have got, specific treatment regimens that are already approved, there's continuation of care. So we did not really experience major disruptions in the private sector. But I do believe that even broader than just the private sector, that, we are almost back to normal in terms of, we are also seeing a pickup also in the number of people now going for their routine checkups. So I think, as the lockdown is relaxed, there is resumption of, usual health care where people are accessing their meds. And I think with cancer, if you already are on a treatment cycle, the interruptions are not ideal, and therefore this is something that we would not, we would be very concerned if it was happening, but we were not alerted to any of those.
Well, that is very, very, very good news as well. And those who need to get back onto their cancer treatments, they've missed those various screenings. You were saying it's all about the early detection during lockdown. Very difficult. You've got to get back now.
And if you look at the breast cancer numbers in sub-Saharan Africa, early detection is already an issue, especially in our rural areas where people aren't getting the help they need as quickly as they should, because people should not be dying as a result of breast cancer, and far too many are.
They are indeed. Let's say thank you to Dr. Noluthando Nematswerani, Head of Clinical Excellence at Discovery Health, joining us today.